I'm Alicia, and I would like to share with you my own personal journey with having had a stroke. And my focus is really to look at the emotional journey within that, because in my experience, the focus of learning about stroke and educating yourself about that is really based more on the medical aspects and on the physical part of your body and the disability of that. Well, instead of that, I'd like to share with you a little bit about how it was for me. So to start with, I'd like to share that the reason I happen to have had a stroke is because I'd contracted Lyme's disease, a microorganism, a bacteria that gets into every part of your system and is very disabling in itself. That then created meningitis in my brain stem, which in turn, because of the thickening of the blood, caused a pontial infarct, or a stroke, a blockage in the blood vessels leading into the pons. And the pons is actually a bridge, literally a bridge, between the right and the left brains. So that in itself, for me personally, shows me that I'm needing to balance and connect those two hemispheres of my brain more. If you think about it, the left hemisphere generally is the more logical side, the more sort of side that deals with numbers and talking, etc., and the coordination, whereas our right side tends to be our more creative side, our more feminine side, our more intuitive side. So there's a very sharp wake-up call to myself in this that I call my stroke of luck, to say you need to balance your right and left hemispheres more, to be more in touch with that. Well, in my experience, I was taken into a stroke ward in the hospital, having had an MRI scan that showed I'd had a stroke. And it was very awakening to me just to see the dears that were in there. Most of them were very old, because in fact, in my 50s, and some people 40s, 30s, 20s, having strokes is quite unusual. It's normal for older people to have those, but not so much for younger people. So for me to see all these lovely old souls in the hospital so disabled, not able to eat themselves, not able to go to the toilet themselves, not even able to speak, it really took themselves out of who they really were. And extraordinarily, what I really noticed was how the nurses looked at them as very much needy, very much wanting to care, and they were beautiful, the nurses, and very patient with everybody and very loving with everybody. But there was a sort of sense that nobody really saw who these people really were before they had a stroke. There was almost like looking at them as if they were stupid and not able anymore. Well, of course, that isn't always the case. In many situations, it can be that you can eventually rehabilitate yourself, or your mind is thinking of something, or you're conscious of being aware to be able to do something, but you're not actually able to do that. Well, I feel very blessed that my stroke was only a small stroke. It affected the left side of me in the majority of cases, so I had a sort of clamped up hand. I couldn't use my left leg. I kept falling over and was very off balance. But actually, what happened was, first of all, I remembered that it's very important to do physicalness, like make yourself as physical as you possibly can, even if you're not that able, even if it's just to move your fingers or to open and close your eyes or to expand your jaw, whatever it is that you can do, it's very good to do that. And at the same time, I also remember there's a wonderful neuroscientist from Boston, from Harvard, called Jill Bolte Taylor, who'd given a talk at TED all about having had a stroke herself in her 30s and how it took her years to rehabilitate herself. So for me, this was also fascinating to be able to watch myself and how I had to begin things again. It was almost like being a child in many situations. So this was all a part of it. And definitely it was like, oh my goodness, I've had something extraordinary happen to me. It was a big thing for me because I also had Lyme's disease diagnosed, so I knew that I wasn't making things up, that I really was in a lot of pain. And the stroke of luck, was that, as I said, wake-up call to say, hey, you really need to pay more attention, because of course our body is a wonderful barometer for ourselves to look at the stresses and the traumas within ourselves. And that isn't necessarily a physical trauma or a physical stress. Sometimes it's looking at what is going on in my life. What am I doing? What am I not doing? How am I being? What are the past wounds that I haven't fully let go of yet? What is it I need to look at? So for myself, I can see now, and this is maybe about 2 months after I had the stroke, that one of the things was I felt as if I was doing okay in life. I was surviving. I was having some extraordinary situations, but I wasn't really thriving. I wasn't really putting my full into what I could actually do. So what happens for me, and what is happening and continuing to happen, is I'm more and more aware of being conscious of the dreams that I've had for years and years and years. Things that I haven't seen come into existence, maybe they never will. But it's awakened me to keep those dreams more alive in myself. So it's a great inspiration to me. And again, I feel incredibly blessed and lucky that I've only had a fairly gentle stroke in comparison to other people. So it's taken me a very short time, with the aid of supplements, herbs, etc., and some disciplines for myself. For example, walking as much as I can, climbing up and down stairs, doing balancing exercises, playing with a jigsaw puzzle to try and get my left hand working a little bit more. All sorts of things to try and build myself up and rehabilitate myself. Of course, we're never exactly the same, because these things are like initiations to us to come into almost like a new form, a new sense of ourselves. And in my case, really, it's a heightened sense of connectiveness with everything, and feeling the oneness of everything, and how everything is a web of life. I've always been able to talk about that. I've occasionally felt that. I've seen it even. But now I really sense that more and more. And my wish in creating this video is really to share that with you, that it may hopefully help you and support you, inspire you to keep going, because it's a really long journey for many people who've had stroke to try and build themselves up again. But a big part of that is our emotional journey. And when I've looked in a couple of books, like Louise Hay's book, You Can Heal Your Life, and another one about emotional healing, stroke is all about a refusal to really fully live life. So this is a big change in myself, and it's also about being willing to change, being willing to have the patience and the perseverance to expand on your dreams that have always been there, but you maybe haven't brought into fruition because you can't see how. And in fact, for myself, I can see that I have these visions, I have these dreams. I don't know how yet, but I'm willing to take the steps one by one to get to that point, possibly. We never know what the outcome is going to be. It's almost like setting the intent, but trying to stay in each and every moment as we journey along. Now, the other big thing for me has been during this, that I've actually not been able to hold my emotions. I've always been an emotional person, but this has really brought them even more so to the surface. And at times, I've had situations where I just start crying, and I don't even know exactly why I'm crying. I just start crying, almost like I can't stop it. And then, in a flash of a moment, I'll start bursting into laughter. And again, I don't know exactly why. So be aware that a stroke, as a heart attack, can really bring our emotions to the surface. And what that's asking us, of course, is look inside. Take time to be. So as much as I'm saying, I need to get out there and do things, it's more, I need to come in here and be more of myself than I've ever been before. It's almost like there are always steps to take, and they're not necessarily outside, they're almost always within us. It's also helping me, now that I've moved through a lot of this emotional journey, it's also helping me to be more present in each moment and to allow myself to do nothing. To, as one film says, to learn the art of doing nothing. So that's, of course, something that we can often in our society feel guilty about, that we have to work all the time. Well, let's consider how about playing more and allowing ourselves just to be more and trust in the next moment. So this is some of the things that I've become more consciously aware of in my own life, in moving through this. And as you can obviously tell, through sharing this, I'm hoping that it will assist and support others. And by the way, I shall put my details below this video. If at all you just want to talk about your own situation, or you want to share some experiences of yourself or others, then please feel free to call or email me. I'd be more than happy, very delighted to help anyone else out who's also going through this journey. And please allow those emotions. Yes, other people around you may find it challenging to be able to accept your emotions, but you have to accept them yourself, and not just take yourself away, but allow yourself in those quiet times just to go inside and be with you, with all of who you are. So I hope this helps you, and I look forward to sharing with you again. I'm sure I haven't covered many things, but I hope this little video will help you. And I've come, by the way, especially to this river to be able to be more in contact with the element of water, which is constantly changing. And this particular one is flowing as well, so I'm to be aware of those emotions and allowing them to flow and allowing that change. Remember, stroke is like an attack on your brain, but remember also that your brain has an amazing capacity of plasticity and can change and adapt. And generally speaking, we're told that we only use about 10% of our brain. Well, what about all the rest? So imagine what we're able to create anew in this world. And of course, our brain, more than the rest of our body, is nearly all water. So everything is possible to change. So please be aware of that. Even if you've had a stroke and you feel that fogginess and that almost like rewiring going on, you're starting to see things differently, you're losing your memory, you can't process information properly, all sorts of things can be happening. But please allow those waters of emotion to flow through and trust that what is happening is for the best, for your highest good. Namaste, everybody. Blessings. And I wish you well on your own journey. Thank you.